Hello, my name is Carl Muller. I'm the Executive Director of the Campaign for Public Health Foundation, and in this video we're going to talk about the FY11 funding debate and how that debate is impacting the budget for the Centers for Disease Control and Prevention. Approximately 70% of the CDC's federal funds go right back out the door to state and local health departments. Colleagues at ASTO were kind enough to send us the following slide, which is a breakdown of what state health agencies spend their dollars on. These are all pretty critical programs that impact the American public. The Association of State and Territorial Health Officials also sent us this next slide, which I think is incredibly important to this whole fiscal year 2011 debate. And what you might not realize is that states have already lost 14% of their workforce. They are a result of cutbacks in state government budgets. So far, federal funds haven't been cut back in a significant way, and so states more than ever are relying on these dollars to support what's left of the public health infrastructure. In an earlier video, we talked about the history of the CDC's funding from 2005 all the way through to today, and the continuing resolution, which will expire on April 8th. The midterm elections definitely changed the tone in Washington. There are about 100 new members of Congress who are dedicated to deficit reduction and who are very concerned about our long-term spending. One of the key points about this is that the House and Senate and even the White House have agreed to look at cuts to non-defense discretionary spending. We have an earlier video posted on our YouTube page that talks about the overall federal government, but just keep in mind that only about 18% of the federal government accounts for that non-defense discretionary spending. So off the table in terms of finding savings are Medicare and Medicaid, Social Security, and military spending. That leaves a very small part of the pie to pull from in terms of accomplishing these cuts. So let's go back to the charts and show what some of the proposals for the CDC are. Soon after the midterm elections, the Republicans in the House produced a bill, H.R. 1, that provided major cuts to discretionary spending. And this, again, is just the Centers for Disease Control and Prevention and how it was impacted in that bill. But you can see major cuts to budget authority, the blue line here, at just above $4.8 billion. Which, you know, is, if you include this bioterrorism funding as base funding, that's prior to 2005 in terms of budget authority. And then the prevention fund was also set on top of that proposal, but several amendments came up during debate to actually strip the prevention funds from the bill, and there were other provisions to not permit the spending of any health reform dollars on current programs, and so that would have eradicated this funding. The bill passed the House on February 19th by a vote of 235 to 198 and was sent to the Senate. And actually the Senate on March 9th voted on both H.R. 1 and a substitute amendment to H.R. 1, which was the Senate proposal. And again, it proposed a cut to budget authority that would have been back to about 2008 levels. It's important to note that in the Senate proposal, much more so than the House proposal, the Prevention and Public Health Fund did push the CDC's budget up to do more than it had done in the past, as was the original intent. The pressure in Washington now is to find a compromise that will fund the federal government for the next 6 months or through the end of fiscal year FY11. You can see from this graphic that there's a long way to go to find a compromise, at least so far as the CDC is concerned. And there is talk of splitting the difference between the proposals and meeting halfway. If that were to happen, the CDC's budget may fall back to 2005 levels. And there is certainly impacts for public health in this entire debate. The President's 2012 budget request has a number of really interesting things to point out. The first is a fairly major cut to budget authority to the CDC. The second is the use of more evaluation transfer and emergency funds to bolster the CDC's budget. And the third is that the prevention fund is used to fill the gap caused by this cut in budget authority. There is an increase to CDC proposed in the President's budget request. It's a slight increase over the continuing resolution funding, and it is an increase over 2010 funding. But unfortunately, there is also a supplanting of the prevention dollars, which the public health community had hoped would enable us to do more to prevent disease and disability in the country and maintain or reduce healthcare costs. I think it's safe to say the public health community is concerned that a cut to budget authority could have a very major and negative impact on CDC and in fact the entire nation's public health infrastructure if it were to happen in combination with a repeal of the Prevention and Public Health Fund. The reason for that, ever since health reform passed back in 2010, any number of proposals have been put on the House and Senate floor and in committee as well to repeal the Prevention and Public Health Fund. The impact of that, if budget authority has also been cut to the CDC, would be very dire. You could imagine a situation where H.R. 1 were to pass and then the Prevention and Public Health Fund were to be unavailable to the health community. Given all we've already discussed about the needs of state and local health departments, you could imagine what a cut back to pre-2005 and perhaps even 2003 levels would mean for the Centers for Disease Control and Prevention. With that, we thank you for your time. Feel free to visit us online at cphfoundation.org.